Hi, Karen here again. This is day 6 post-op from the spinal cord stimulator surgery. This is not the trial. This is post-op day 6 from the actual surgery, the actual placement of the permanent spinal cord stimulator. I made a video day 1 post-op, day 2 post-op, but days 3 and 4 I didn't. I wasn't really feeling up to making it those 2 days. I feel a little bit better today, and I had a few other little, I don't even say complications, but other matters that just didn't really make me feel well enough to make a video. Okay, so let's get to it. I had the surgery on September 18th, 2017. Today is, August 18th, 2017, and today is August 24th. So like I said, I'm having quite a bit of pain, and let me first tell you again exactly where my incisions are. If this is my back, the first one is an up and down incision right in the middle of my back, kind of up a lot higher than you would normally have the injections or anything like that. So it's a straight up and down, and then on my left side above the waist is where he placed the stimulator. The stimulator is a little metal box. I sometimes refer to it as like a pacemaker because that's kind of what it looks like. I'd say it's about maybe 2 by 2, maybe a ½ inch thick. I'm not positive. I didn't actually see it before they put it in. So, and then that over there where they put that in, there's a scar. I'm going to say it's about this big, about 2, maybe 3 inches long, where they put that in. And you can kind of feel, and I have a lot of bruising, a lot of black and blues all around the whole area. I tend to black and blue very quickly. I've seen pictures of other people who had the same thing. They don't have any black and blues. It might just be something that happens to me. Anytime I've had any surgery, it's just black and blues everywhere. So you can also see a black and blue where the wires are that connect the two, because they put the paddle on your spinal cord attached with wires down to the stimulator box. So right now I'm having pain in all 3 of those areas, where they place the paddle, where they place the stimulator, and even where the wires are. I'm having all kinds of pain in all 3 areas. But thank God today, that's all I'm feeling. It's just pain from the surgery. Yesterday, let me say, if you're going to have this surgery or any surgery, and you're going to take, especially if you're going to be taking painkillers, your system doesn't really start up that quickly, and if you wait too long, you're going to have a lot of trouble going to the bathroom. So that was my problem yesterday. From Friday until yesterday, I hadn't gone. So that was like Friday, Saturday, Sunday, Monday, Tuesday, almost 6 days. And during those times, I started right away. When I came home from the surgery, I started right. Normally, I take Senokot every day because I take the painkillers. So your system is kind of sluggish anyway. So I take Senokot every day. I immediately added to that a stool softener, which is kind of like, well, this is I usually get from Amazon, but it's usually like a Colace. I took that, plus I took the little Dulcolax tablets. I was taking them every day, sometimes more than once a day, and then by, I think it was Monday or Tuesday, I started with suppositories, and they didn't do anything. They really didn't help much at all. And I hate to talk about this at all because it's just gross, but I just want you to know, if this is something you're thinking of, don't go more than 2 or 3 days without going to the bathroom, and I'm talking number 2. I don't want to get gross. So yesterday, I had my husband get me an enema. You know, it's a Fleet enema. It's basically a bottle filled with like a kind of gel kind of solution, and you just well, you could read the instructions on your own, but you put that in, and then you wait a few minutes, and then all hell broke loose. And I guess I would have been ready for a colonoscopy at that point. It was really a bad situation. So next time I will. Well, hopefully there won't be a next time. But if there is, I would never wait that long. But be very conscious of that. You know, if you have the surgery on a Monday, by Wednesday, Thursday, you're not going to the bathroom. Ask your doctor what you should do about that, what you should be taking. So that was a big problem. Finally, that's probably why I feel a little bit better today. So, and the pain hurts. It does. It still hurts. I'm all black and blue, and I'm taking my pain medication, but it just doesn't. It never ever gets rid of it completely. I will tell you one thing. Laying down is much more comfortable than sitting up. I think when you're sitting up, you're putting a little too much pressure on the incisions. So I end up laying down and watching TV a lot. That's another thing. Also, you would want to know how long it's going to take to recover. I would say, like now I'm almost like tomorrow for me will be 1 week. I'm totally not recovered. Absolutely not. I can't really look into the future, and I will try to keep you updated. After today, I might make a video once a week until I am fully recovered, so this way you'll know how long it took me. But I would say, in general, for the first 2 weeks, you're really not allowed to do much of anything. You're not allowed to lift anything. You're not allowed to bend. You know, a lot of different things. They want you to, you know, just to recover. That's for at least 2 weeks. So minimum recovery time would be 2 weeks. I think for me, I would probably be starting to feel more like myself maybe after 3 weeks. And then I wouldn't really resume my full activities, I'd say at least a month. And possibly 6 to 8 weeks for it to completely be healed. I'm assuming all my black and blues will eventually go away. One other thing, I'm doing this with Boston Scientific. I know there are a couple of other companies. If you're looking into this and you want to find out information, you can call Boston Scientific or go on their website at bostonscientific.com. There's a lot of information there on the spinal cord stimulator, the trial, and everything. And I think you could call them up if you have any questions. They're very good. When I got my stimulator, and oh, this is the remote control. This is the remote control that you use that I would assume you should never ever lose, because I'm going to assume that if you were to lose it or break it, I don't know that it's covered, and I'm assuming it's going to cost a whole lot of money. But basically, this, you hold this down, it unlocks. Right now I am on a stimulation where I don't feel anything, and I'm at 50%. You could make it go down to 2%. You could make it go up to 100%. And there's a couple of different programs in here. And for now, until I go back, I'm going to the doctor on Monday, and the representative will meet me at the doctor's office to probably give me some more programs. Right now, I just have programs for my legs. Most of my pain was my lower back and my hips and my legs. So he didn't want to make any programs for my back because I'm still healing and everything. This is the charger for this. And what this is the thing that will charge the stimulator, which is in your body. And they give you a belt and a pocket. You put this in the pocket, you put the belt on, and it will find it on you, and it'll beep and do certain things, and they give you a whole video on how it works and everything. Also, again, if you're getting it from Boston Scientific, call them up at any time. They're very, very helpful. They're very professional. They will help you every step of the way. The belt, of course, the belt that I got was about this much too short, so I had to order a belt extender, which we called up, I think 2 days ago, and it came FedEx without any charge. So don't be afraid to ask whoever you go with. Make sure you get somebody that you could call and talk to about any problems or questions that you have. And that's about it for now. Maybe I'll probably post another video after I go to the doctor's on Monday and let you know if there's any other information. Again, please subscribe, or any questions, put them below the video. I will try and answer them for you. And good luck to you if this is one of the choices you're going to make. Okay, bye now.